Hi everyone, welcome to our expert-led technology session. I'm really delighted to welcome Obert Taradera, who is an alumni of the Sustainable Care Programme, but is also a colleague of mine at the Impact Implementation Centre, where he is a research fellow and project officer. And he's going to talk to us today about research he's done around transnational care and how it's facilitated or at least changed by the use of technologies such as WhatsApp. And Albert has recently published a paper, which we can put in the chat that you can go away and read. But without further ado, I'm going to hand over to Albert.
Thank you, Kate. Thank you for the introductions. Thank you, everyone, for coming. Really pleased to have you to come and listen to me speaking. I don't normally get these opportunities. So when they do come to me, I'm really, really excited. So today I'm going to talk about the study that I did as part of my PhD. It's looking at how Zimbabwean transnational families navigate transnational aged care through the use of new technologies, but with a particular focus on WhatsApp. Just mute myself there. Okay. So just to start as a way of introduction to give you a bit of a synopsis of about where this whole research comes from. It comes from the understanding of new transnational families, which are like families which have got like one or more members of the family living in a different country. And these new transnational families are now becoming really increasingly prevalent due to migration trends and the mobility and immobility that's happening in the world right now. The impact of these transnational families is particularly felt in care, especially in societies where family serves as the primary source of care, of support for older people. So due to that, we find that many families are now increasingly turning to new digital technologies as substitute for transnational aged care. And these technologies, especially mobile applications like WhatsApp, for example, which will be what I'll be concentrating on here, play a significant role in shaping transnational care. There's a lot of literature that is around the use of new technologies in transnational care. And most of this literature normally looks at the use of these digital technologies as empowering for migrants and also as the social glue that keeps migrant families together. The only thing that we normally have, most of this literature that's there out is normally looks at internet-based platforms like Skype or emails. That was like at the beginning of the trend of looking at transnational families and new technologies. Skype was the most researched platform, as well as emails, and these were the ones that were seen as having revolutionized the way care is done at a distance. But now there is a lot that's going on around the use of mobile phone applications like WhatsApp, and these actually remain a bit under-researched in the context of transnational care settings. So also research tends to be one-sided when you look at most of it. It looks at the migrants themselves and normally doesn't look at the other side, which is the families that are left behind or those who remain in the country of origin. So to sort of like plug this gap, I thought like investigating this influence of WhatsApp family groups is really important, and the research that I'm going to talk to you about encompasses the perspective of Zimbabwean migrant care workers here in the UK and their left behind family members, particularly those siblings that are involved in the care arrangement of a family member. Here I centered the family in the discussion, viewing care as relational and also migrants as embedded in these kinships of care. I explore how family members utilize WhatsApp for family interactions and the implications for cooperation and information management. Here I argue that members do family through a WhatsApp family group, and it is pertinent for us to investigate these new forms of doing family in order to understand how new technologies may or may not enable cooperation among family members, and also to look at what sort of strategies family members develop to curate, share, or moderate information, particularly when they are doing it for care. The reason why I concentrated on WhatsApp was that because WhatsApp emerged as the preferred contact platform for most of my participants due to its widespread use and accessibility in Zimbabwe. In Zimbabwe, also mobile phone usage has become very, very prevalent, actually supplanting traditional landline. I know this is the norm everywhere, where the coming in of mobile phone, normally many people now own them. But if you look at a country like Zimbabwe, where particular mobile landline telephone was not as developed as in the first world countries, you start to understand why these mobile phones are really important, because most people now own them, and for them, WhatsApp was the one that they preferred to use the most, and it actually serves as that digital space that connects Zimbabweans across the globe, also shaping kin relationships. Before I go any further, I think it is best for me to give you just a context of this study for you to understand where I'm coming from in terms of family and care in a Zimbabwean context. So in Zimbabwe, there are two main cultural ethnic groups, the Shona and the Ndebele. There are many, but these two are the main ones. And the tradition and the culture between the two is normally the same. There's not much of a difference. For both, kinship is central to family life, with extended family members actually supporting each other during difficult times. This is actually pronounced in the concept of Ubuntu, and which actually emphasizes compassion, reciprocity, and interdependence. And this is what shapes caregiving practices within Zimbabwean families. Within Zimbabwean families, also gender is really important because women are the ones who normally take the brunt of doing care work. They do the care and the caregiving, and traditionally it comes from the concept of women being seen as the backbone of the family, and this is normally symbolized in Shona expressions. Like Mushamukadzi, a colleague of mine, Rotamadziwa, has written a lot around this concept, and this actually highlights the central role that women play in care and caring and in managing the family in a Zimbabwean context. Zimbabwean society is also very, very patriarchal, and it runs along that patriarchal system where older people are respected and are seen as the custodians of wisdom and culture. This hierarchical structure within these families also underscores the importance of the elders as sources of knowledge and conflict mediators. So these are people who they are revered in society, and they are supposed to be well taken care of. So if someone gets old, they are taken care of within the family. Also, unlike in most Western societies where people rely on pensions, in Zimbabwe, people they rely mainly on the family because there's a lot of history behind what has happened in Zimbabwe. Actually, I don't want to go into that because we might spend the whole day here. But for those of you who know a little bit about Zimbabwe, I think the biggest thing that people know is that we had $1 trillion Zimbabwean dollar note. And if people remember, during the time of hyperinflation, so most people, we had their savings in as pensions, had their savings wiped out when by hyperinflation, and also when the country sort of dollarized and went on to start using the US dollar. So most people just lost their pensions, and now the family becomes the most important source of care. Every time that I've given this talk, people have always asked me, like, what about care homes? Why are people not put in care homes? It's not that easy, because in Zimbabwe, care homes do exist, but they exist for the rich. And traditionally, during colonial periods, care homes were there, and these were used only for white people and those who were rich, who could afford. For most of the Black people, their care was supposed to be done by the family, and the colonial system that was there actually buttressed this idea of the family is always there to look after its own, and it became a system whereby when the white people were actually accessing most of the care homes that were there, and they were accessing sort of like the social services that were there, the Blacks were left to look after themselves, and the system of saying, actually, you've got a family to look after you, actually carried on. Even when the new government came in 1980, when we gained independence, they sort of like continued that trend that people would be looked after by their own. And there's also the issue of people owning homes in the rural areas. So we've got like the village and the city. So most people spend most of their time working in the city, and when it's time to retire, they retire in the village, because in the village, that's where you've got all your kin, all your people. That's where people say you come from. So you go back, and you always have people to look after you. That has become the norm. But mostly now, because of migration, both internationally and regionally, and nationally in Zimbabwe, this kind of rural living are being disrupted. So, like I said, this research was part of a larger multi-sited qualitative PhD study that I undertook here at Sheffield, and really pleased to be back to talk about it here at the Center for Care, which used to be the sustainable care of which this PhD was embedded. So in this study, I took 2 phases. On the first phase, I looked at Zimbabwean migrant care workers who were employed here in the UK. So my first initial thinking was around interviewing Zimbabwean migrant care workers about their work here in the UK, as well as how do they do transnational care. So the paper that Kate was talking about actually looks at these 10 Zimbabwean migrant care workers. But in doing so, I went on to start thinking about, okay, what about the perspectives of their family members back home? So I kindly asked most of my participants to help me recruit their family members, those who were involved in the care for the named person, and of which most of the participants that I had here had said the cared for person was a parent. So they agreed that, about 5 of them agreed that I can go and interview their family members. But unfortunately, due to logistical issues, as a PhD student, you don't have all the resources around you to make sure that you carry a study as robust as possible. But I managed to get 3 family constellations, and these comprised a total of 11 participants from various family roles. These people in the Zimbabwean sample included parents, siblings, close relatives, and children of research participants who were involved in the care arrangement. So for this presentation in particular, I concentrate on the mini ethnography that I did with the 3 UK-based migrants and their matched family members in Zimbabwe. So all in all, I'm going to be talking about the 14 interviews that I did with these family constellations. So here is the interesting bit. These are the participants that I spoke to in the UK as well as in Zimbabwe. they might look like this for now, but I'll explain a little bit more about how the whole relationships were working here. Most of the people that I managed to talk to here were just core family members, you know, the immediate family members. I didn't get the chance to sort of like go into the whole extended kinship family setting. So on the left, you can see I've got the UK-based migrant participants. So I've got Melusi, Charity, and Kuda. These were these were migrant care workers here in the UK. And then next to that, I've got the name of the left behind family members. These are the left behind family members that I had the opportunity to interview. So in Melusi's family, I interviewed his father, Kumalo, also interviewed his brother Jabu and his two sisters, Toko and Nomsa. In Charity's family, I interviewed Hema Damadube, also Charity's two sisters, Precious and Grace. And in Kuda's family, I also interviewed his mother, his son, his brother, and one of his sisters. But there were other people involved. I'll come to that quickly. So all the participants that I interviewed, irrespective of age, gender, or location, they were all actively engaged in their extended family network through WhatsApp, and they created WhatsApp family groups. And it was really interesting to see something that's a virtual home that was being created where people could actually come together and start doing things together as if they were a family. So of the families that are there, I'll give you a better understanding of them, so that when I move on to the proper findings, you start understanding. We've got like Melusi's family. This WhatsApp group was loosely connected, and it revolved around his father, Kumalo. We had, I'll go back a bit. So it revolved around his father, Kumalo. Kumalo was in the age between 75 to 79, and Kumalo had healthcare complications. I think when I spoke to them, it was something to do with gastrointestinal problems, and he had some acid reflux. The family group, I didn't get to go around who created it, but this was one of the larger family groups. So the people that I spoke to here are normally like a third of the people who were in the family group. But it was really a traditional kind of a family group, which was very hierarchical, very traditional, and everything was followed according to tradition and according to culture. I'll come to that a bit. Then we've got Charity's family, and this one, the Charity's family was actually created by Emma Madube. And actually, when I spoke to Madube and asked her why she created the family group, she said she just did it because she wanted to stay connected with their family, particularly Charity, who was in the UK, and they also had a brother who was in the US. So this family actually worked very well. So though the Madube created it for that particular purpose of staying in touch with family members, it ended up being actually working for the care of Madube herself, because she had a heart problem and actually had a pacemaker put on her. And the WhatsApp family group really worked well in coordinating her care. Of the three families that are here, Charity's family were a bit of a well-off family. They have the father of the house, who I didn't interview, but for some reason he was there when I was interviewing the wife. Is a former army general, and so the Madube herself used to be a teacher, and well, Precious and Grace, the sisters, they've got like very good jobs. So it was a really well-off family. They lived in a posh side of the capital, and they had a maid in the house. They also had a gardener who helped them with their massive piece of land that they had. Then we've got Kuda's family, which was the last of the families here, and Kuda's family, Mamoyo, Gari, Farai, and Netai. This one was more involved with Kuda's father, who I didn't manage to interview because when I went, I was supposed to interview him, but when I went there, his health was really failing, and for ethical reasons, I couldn't do the interview. But I did speak to the family members to understand a bit more about this family. So the WhatsApp family group was created by Kuda, and for Kuda, the thing was, because he was in the UK and he's the eldest son, he took it upon himself that he's supposed to be the one who's caring, and actually with his father's health failing, he assumed the duties of the patriarchy of the house, and he and his other brother, who is not here, who is based in South Africa, are the ones who actually help a lot with managing the group. So there's a lot of group dynamics that I'll talk about that happen in these families. So the first thing that I want to talk about from what I got from the findings of this is how these new technologies actually play a crucial role when it comes to managing long distance care, and how they are so pertinent when it is during a time of a care crisis. So a care crisis, according to Loretta Baudassa, is when a family member needs an emergent family or any emergent care, and then everyone has got to pool resources together to try and get that family member to get the good care that they should get. So this is where you start seeing the importance of using new technologies. I was lucky when I was there. I would say lucky in a way, but that when I went there, when I was doing my interview with Jabu, his father was in hospital. He had been in hospital for 2 days, and when I went there, when I finished the interview with him, he actually asked me if I could accompany him to the hospital because his father had got discharged. So it was really interesting seeing him actually making phone calls around, talking with family members, telling them about what's going to happen, the aftercare that they will need to give to their father, and how they are going to do it. But in all that, I also started seeing that although this was really important and the coordination was happening, you start seeing maybe where the limits are with using new technologies, or with relying on the family WhatsApp group in a critical health moment, because most of the people now were sort of like panicking, and the information that Jabu was actually conveying was making people panic at that time, from what I deduced, to be honest. And he wanted to make the situation feel as if everyone's got to get involved. He actually told me himself that this is the only way I can get people to make sure that everyone is active in doing this. So you could start seeing that actually, okay, there are limits here, but also there are limits that I actually discovered when I did my interviews with the migrants here in the UK, especially when a healthcare crisis happens. A case in point is that of Charity. She told me that it was a difficult time for her when she received news of her mother being hospitalized and being told that she actually needs to have a heart surgery to get a pacemaker fitted. So for her, receiving that news of a major health scare led her to feeling guilty and empty, and a sense of shame for not being there to help her a mother in a time of need. And she actually told me that at that particular point, she didn't trust most of the information that was coming from her sisters. First, she thought maybe they were downplaying what was happening, like thinking that it might be they don't want me to worry, they don't want me to feel guilty, they don't want me to to be stressed about it, so they don't tell me exactly what's happening. But personally, she said she wanted to know what was happening, but then this is where maybe the good things about new technologies actually come in, because she managed to get in touch with their mother after she'd come out of the operation, and was able to do it through a video call, and the video call was done through a WhatsApp a video call. So she said that seeing her mother at that particular point, seeing those non-verbal, seeing it, you know, how she was, actually made her feel better. So that was really, really important. She also managed to speak with the healthcare providers. She asked if she could speak with the healthcare providers, and was able to be told what's wrong with her mother and all that. And she was actually able to follow up with them in terms of what to do, what are the next appointments, what's needed to be done. And at this particular time, this is where it really became important that money came in to become really, really important in the whole thing. So remittances, this was the bone of contention. When I was talking about this, I was actually glad that I spoke with each person by themselves. Not if I had put these people like in a focus group, I'm sure they would have been at each other's throat. Because when you talk about money and remittances, it ended up being the thing that many of them spoke about a lot. And the money was the money that was being sent by the migrant care workers that I interviewed in the UK, as well as other family members elsewhere who were overseas actually sending money. And this money, the one I concentrated on, was the money that was being used for the care of the older person in the country. Why, you might want to ask, why was money so important? In 2019, when I did these interviews in Zimbabwe, the country, it was like the first time we'd come out of the Mugabe regime, and the new government, or the new dispensation, as they like to call themselves, were trying to stabilize things. So the US dollar had been the currency that's been used since 2010. So now there was a new, they brought back the new currency, which was known as bond notes, but it was like a currency that they were trying to push so that people could use. But most people didn't have faith in this new kind of money. They had faith in using their US dollars. So US dollars were the preferred currency, and everywhere where you went, people wanted you to transact in US dollars, even though the government itself was actually saying US dollars are not allowed. You find that in most private sector, the US dollars was the only preferred currency. So also at that time, the healthcare in Zimbabwe was failing. The healthcare system was actually on its knees, and most people relied on the private sector clinics and hospitals for care. And for the lucky ones who've got children or relatives overseas, they could easily access private healthcare, because as long as they've got the foreign currency, it was easy for them to access. So that was why remittances were really important in this case. And actually, borrowing from one scholar, I can say remittances in this case were a currency for care. So the new technologies, again, were really important here, because they actually facilitated the convenience and accessibilities of sending and receiving remittances, as well as of keeping track of transaction. When I spoke to Kuda, Kuda works as a living carer, and he actually told me how he welcomed the use of new technologies, because before he used to go into the city to go and deposit money at a Western Union or at MoneyGram, and then it takes some days, and then someone back home will need to go to a bank or to a Western Union branch or MoneyGram branch to withdraw that money. And for him, he was saying that during that time, it was difficult as a living carer. Sometimes he would not have the time to go and deposit the money, to go to the city and deposit the money. So he would rather rely on a time when he's off to do the transaction. But now with new technologies, he can actually, he's got an app that he just uses anytime that there's a request for money back home. He can, if he wants to send it, if he's got the funds, he can just send it straight away, and straight away they'll also get it, because money can be transferred into from their Kuda's mobile phone, and there's also mobile money that is prevalent in Zimbabwe, known as EcoCash. So that actually helped quite a lot. But also, this helped in actually keeping transactions. There were issues around the misuse of funds. And there was a lot that we talked about with the participants about this misuse of funds. For those in the UK that I spoke to, the migrant care workers, when I felt like I was the messenger for both sides when I was doing this. And I remember, because my study needed a lot of reflexivity. So I felt like I was a messenger, because when I spoke to the people who were in the UK, Kuda, Grace, and Melusi, they were all telling me that when you go home, please go and tell them that money does not grow on trees, and make sure that they understand that we work hard, and we don't come across money easily. When I went to Zimbabwe, obviously without telling them the exact words I was told, I only asked. I was also told that to make sure to go and tell those back in the UK that they need to work hard, because otherwise people here will die if we don't get that money. So you could see how remittances were really, really important in this case. So there was quite an impact of new technologies on remittances. I know, like the literature says, these new technologies are empowering, and I could, from Kuda's statement before, yes, he had said it's empowering. He felt like he could have that an app that he could just use in a minute and send money, but they also became a burden for the migrant care workers when I analyzed it, and they actually became objects of exploitation. So they were so remittances were like, the new technology itself was like a double-edged sword, where in one point it's good, on the other point it's bad, because it generated a lot of pressure for them to remit. So it was easy now for family members to ask for money, or to, and to demand money to be sent straight away. And, and the statement that I have there is from Melusi, who actually thought that WhatsApp is not good. He actually said, I curse WhatsApp, because every time, like when I'm speaking to people back home, I'm told about now and then my brother calls and talks about this project and that in the village, and I can tell he's recruited my father because they always want me to send money. So there was a lot of pressure now for the migrants to be sending money, and because it had become so easy for them to send money, and so easy for people back home as well to ask for that money, they no longer have to write letters, which you can say, I didn't see it. So, it's a message is sent on WhatsApp. Once it's blue ticked, someone knows that you've read it, so you're supposed to act. There was a lot of power hierarchies that were happening in these groups as well. There were a lot of power inequalities that I actually observed, just that in terms of the way they were doing the care. Messages were sort of like, there was a lot of misunderstanding, misinterpretation, as well as disagreement amongst families about how to do the care. And in most of these cases, you could find that it's either those who had the power of patriarchy were the ones who had the power, or those who had the power of money as well. So in terms of the two families that this was really prevalent, was Jabu and Melusi and Kuda's families. In Kuda's family, Kuda was the main breadwinner, and he actually controlled what happened in the family group. From what I gathered when I spoke to one of the participants, one of his brothers, Farai, he actually told me that at one point he got kicked out of the family WhatsApp group by Kuda because he disagreed with what he was saying. So Kuda, as the administrator, had the power to kick out Farai from the family WhatsApp group. And then after the intervention of the mother, actually, that's when Farai was reintegrated back into the family WhatsApp group. So you can tell that in a family WhatsApp group, obviously there's someone with power and there's someone with no power. And Kuda's power in this case came from him, not only being assuming the patriarchal power, but also because he had that material power as the one who was providing for the family. Also in Melusi's family, where tradition and culture was really important, actually Melusi himself said he found it quite good that in the family WhatsApp group, it became easy for communication, because in these traditional families, it was so difficult as to who do you tell first when an issue arises. If you miss the hierarchy, you might confuse a lot of people, and some people might actually not come or might not respond because they will say, why was I told last? So Melusi said he found it really easy because tradition in his family actually dictates who you tell first, second, and what. So he could now just put a message on the family WhatsApp group, and he would make sure that everyone sees it at the same time. So there won't be anyone saying I wasn't told. So these examples actually shows us how these family dynamics actually can lead to tensions and conflict within the families, as well as how they can actually strategize around them. There was also a lot to do with gender and care. Gender was really salient in all this, but you could see how these WhatsApp family groups were actually perpetuating traditional gender roles, and women remained sort of like relegated to care and caregiving responsibilities, and their decision making was limited. So a lot of the men were the ones who were like making most of these decisions. When I spoke to Netai, who's Kuda's sister, Netai told me that she doesn't make any decisions around how the care for their father works, even though it was the mother who was looking after the father. Netai was married and actually lived in a different city from her parents, but she is the one who's normally called upon when there is a care crisis, or when her mother has had like problems, or when she needs someone to sort of like alleviate the burden of caring for their father. But she wasn't involved in the decision, how it's made, or what. She says all she can do is just to follow what she's being told. Also, the women in Melusi's family, they were a bit clever, because they said, in as much as that we have a family WhatsApp group, there's a women-only WhatsApp group. So that women-only WhatsApp group was where decisions were scrutinized. And as much as the men in the main group would have said, we are doing this, we are doing that, because the women were the one who were doing most of the care, they had their own fringe WhatsApp group elsewhere, where they would actually discuss and think about whether what has been discussed in there by the men is feasible or not. And from what I gathered, it was what they discussed in their own WhatsApp group, what ended up happening, because they were the ones who were actually doing most of the care. So that was really important. Lastly, like I'll just look at how these family WhatsApp groups also led to exclusions from the family. I spoke about the issue of Farai being excluded from the family WhatsApp group once by the administrator Kuda. There were also issues around people thinking like being connected every time. Everyone were complaints like the problem now, because we are connected every time. You are supposed, or you are expected to participate whenever there's a health crisis, or you are supposed to respond to messages as they come. So belonging into a family WhatsApp group was an obligation. So for everyone was supposed to belong, to show that you care, and you are pressured to stay in that group and to read messages as they come. So you were not in a way allowed to leave. So excluding yourself or leaving the WhatsApp group was seen as an abomination. And people, they talk about the moral judgments of what would happen when they are excluded from these family WhatsApp groups. You know, they would feel like they are out of the family already, so they will miss on some of the important information that is being relayed, especially around the care of their loved ones. So most people felt that they could not leave the WhatsApp group. They would just have to stay in order for them to be able to be part and parcel of the care arrangement of their family member. So just to conclude, like I said, the WhatsApp has actually revolutionized how care, revolutionized care coordination. It has allowed for streamlining of communication, and also sort of allowed for financial support across borders. So it's also been good for kind of sustaining family bonds, fostering continuity despite geographical distance. You could see that it has improved the way remittances are sent, and ensuring that these vital resources reach those in need. But would we say they were empowering for the migrants or for everyone? Well, it's a bit of a big judgment that's needed. But what you could actually see from all this was that managing care arrangement through family WhatsApp groups was really complex, and there was a lot of gender dynamics and family pressures that were at play. And you could see how these family WhatsApp groups actually may perpetuate gender inequalities, reinforce traditional roles, which actually impact family relationships. Thank you so much for listening. I think I will stop there.